Role and professional ethics of care worker. Number 1, professional ethics of care workers. Number 2, interpersonal collaboration. Number 3, care services. Professional ethics of care worker. There are three. The professional ethics of care workers. Number 1, consideration for privacy. Number 2, maintaining confidentiality. Number 3, prohibition of physical restraint. And number 4, abuse. Consideration for privacy. The user's skin is exposed during bathing and toilet use. It is important for the care worker to give consideration for privacy of user so that he or she will not feel embarrassed. Maintaining for confidentiality. It is necessary for care worker to obtain information on the user in order to provide appropriate care. He or she must not, however, disclose the personal information, age, address, clinical history, etc. of the user to any third party without user's permission. A care worker must not spread the information on the user on the internet, SNS, etc. without his or her consent. Prohibition of physical restraint. Physical restraint means the restriction of user's physical movement. Adverse effect of physical restraint. Physical restraint has adverse effects such as the reduction of physical abilities and worsening of dementia symptoms of the user. Example of treatment that amount the physical restraint. Number 1, restrict movement by drying the body, hands, and feet. Restrict movement by tying the body, the hands, and feet. Okay? Put safety rails. Number 2, put safety rail on the bed so that the user cannot get off of the bed by himself. Number 3, lock the door of the room to keep the user inside. And number 4, have the user wear a restraint belt to keep him or her from standing while sitting on the wheelchair. Administer an excess amount of psychotic medication. So that are the examples of amount of physical restraint. Then number 4, we have the abuse. Abuse means the violation of human rights of the user. There are 5 types of abuse. Number 1, physical abuse. To use violence on the user's body. Yung nananakit. Number 2, psychological abuse, to speak and behave a manner that will cause the user psychological trauma. So, nananakit sa pamamagitan ng pananalita. Abandonment of nursing care. Number 3, neglect. To leave the person in need of nursing care attendant. Number 4, economic abuse. Obtain economic benefits wrongfully from the user. So, pwedeng ninanakawan mo yung user. Okay? Ng kanyang kayamanan, kanyang pera. And number 5, sexual abuse. To commit incident act of the user. Number 2, interpersonal collaboration. Team approach. Various professionals other than care worker work as a team for user using their respective expertise. For example, From the user, we have the assisted living care, nursing, which include the care manager, care worker, who is certified care worker,
Gusto ko raw niya maging
social worker, certified social worker. We have the medical care team, which consists of the doctor, dentist, and nurse. And we have the meals and nutrition team. We have the cook and registered dietitian. Next is the rehabilitation team. This is including the physical therapies, speech language therapies, and occupational therapies. Number 2, the role and function of other occupation. Professional that performs medical activities. Medical activities are conducted based on medical knowledge and skills. Basically, care worker cannot be engaged in medical activities. Doctors and nurses are professionals that perform medical activities. Sample the doctor. The doctor diagnose and treat diseases. The nurse. The nurse, following the instruction given by the doctor, provides recuperative care and assist the doctor in providing medical care. Rehabilitation professionals. Rehabilitation professionals who provide functional recovery, training, etc., including physical therapists, occupational therapists, and speech language. Hearing therapists. For example, the physical therapist gives training of physical abilities such as walking. Number 2, occupational therapist or OT. An occupational therapist gives training of activities necessary in daily living. We have the speech therapist or ST. Speech language hearing therapist gives training to users who have difficulties in speaking and swallowing. Deglutition. Professionals on diet. There are users for whom special care needs to be taken about forms of meals, calories, due to diseases. A registered dietitian is a professional on food and eating. Registered dietitian. A registered dietitian develops nutritionally balanced menus. Professional who give consultation and make adjustment regarding welfare services. Care managers and social workers are professionals who develop and support plans, give consultations, and make adjustment regarding the services when users use welfare and other services. So I will repeat. Professionals who give consultation and make adjustment regarding welfare services. They are the care manager and social worker, certified social worker. So the care manager and social worker are professionals who develop supporting plans, give consultation, and make adjustment regarding services when user use welfare and other services. A care managed social worker gives consultation to users' contacts and users' family to make adjustment. So, yung care manager or social worker, sila yung nagko-consult sa user and contacts the family member and make adjustments. And number 3, we have the care services. Overview of care services. There are various kinds of care services. Care service provided by home visits. Care workers are visit, etc. visit the home of the user to provide care service. Home visit care, home health service, and other services are available. Number 2. Care service provided to visiting care recipients in care facilities. Service is provided to the user in care facilities during daytime hours. Daycare or day service and other services are available. Number 3. Care service provide to use living in care facilities. Service is provided to use in care facilities. Service in facilities for elderly covered by public aid requiring long-term care. Intensive care, home for elderly, etc. is available. So 3, there are various kinds of care services. Number 1 is care service provided by home visit. So it means the care worker visit the user home to provide service. Number 2, care service provide visiting care recipients in care facilities. So, from user's home, they visit day service, etc. Number 3, care service provide users in care facilities. Care service provide the user living in care facilities. So the user can live. They can have intensive care home for the elderly. So they can live in the care home facilities. Number 2, care process. Care worker provide care in accordance with the care plan, aiming to supporting the self-independence of the user. In the care process, a care plan is developed for each user. Basic flow of the care process. So the care process, what is care process? A care worker provide care in accordance with the care plan. So that is the care process. So the care worker provide a care plan according to depending on the user. So a care plan is aiming to support the self-independence of the user. In the care process, a care plan is developed for each user. So this is the flow of the care process. This is a basic flow. We have the assessment, care plan development, care plan implementation, then evaluation. So in the assessment, they gather information on the user and analyze the issue of daily living. And then number 2, they do care plan development. So they develop the contents of the care plan to offer to the user. And then next is number 3, the implementation. The care plan implementation provide care to the user based on care plan. And lastly, number 4, and they evaluate whether the contents of the care plan are suitable for the user. Ensuring safety and risk management in nursing care. Ensuring safety in nursing care. Number 1, importance of observation. Number 2, health management of care workers. Number 3, use of principles of body mechanics. Number 4, infectious disease and control measure. And number 5, accident prevention and safety measure. Okay. So, ensuring safety and risk management of nursing care. Ensuring safety in nursing care, the importance of observation. So, what does the observation mean? Observation refers to the carefully look at and find out the state of the user. For example, seems different and unusual. How come? So the care worker observed that the user is have unusual body mechanics or body movement while walking. So that is some example of observation. Number 2, significance of observation. What a care worker observed will be used to improve the life of the user. So, observation. The things that have been observed are recorded and shared by all the staff. Okay, so everybody should know the condition. Then we have the method of observation. There is information obtained by getting involved with the user. There is information obtained by measuring, etc. There is information obtained by using measuring, etc. For example, I think your body is hot. Let me take your temperature. His body is hot. So it's the part of the method of observation. They need to get the information involved with the user. Okay, involving the user. So, using the body thermometer. Then we have the health management of care worker. Importance of health management of care worker themselves. It is necessary for the care worker to maintain his or her own health. It is not possible to provide a better nursing care if the care worker himself or herself is not healthy. That's why it's important to have a proper diet and exercise. For the maintenance of good health, prevention of lower back pain. So, it's easy for the care worker to suffer from lower back pain. So, please be careful. Lower back pain can be prevented with correct knowledge and implementation of such knowledge. We have the posture and lower back pain. The use the body mechanics can help prevent the lower back pain. For example, for getting a box from the floor, you should bend your knee when lifting it up. So bend your knee first and then hold the box and try to lift yourself. And number 2, the way of picking up the things tends to put a burden in the lower back. So should not forget to bend your knees. Use the principle of body mechanics. At the time of providing assistance in walking, lifting, transferring, it is necessary to ensure the safety of the user and reduce the burden on the care worker. So what is body mechanics? Body mechanics refers to the way our body moves based on the relationship between bones and muscles. Ulitin ko, body mechanics refers to the way our body moves based on the relationship between bones and muscle. That is body mechanics. With the use of principles of body mechanics, you can provide nursing care safety with a small amount of force. Maintain a wide base support and lower the center of gravity. So use a cane can widen the base support, and increase the stability. So, explanation of terminology. What is base support? Base support refers to the area created by connecting every point of contact of a person with floor surface for the purpose of supporting her body. If the person is standing with his or her feet apart, the base support is the area surrounding the outside of his or her sole. So that is the base support. So bring the center of the gravity of the care worker and that of care recipient close together. So like this. You can provide care with a smaller amount of force if you are closer to the recipient. So the bigger the muscles, use bigger muscles such as the thighs. Bigger muscles or lower thighs and buttocks are used in proper body mechanics. So the person is lifting the box with the knee and the joints kept straight is using only his lower back muscle. It's wrong posture. You can provide nursing care easily by using a bigger muscle. So number 4, tuck the user arms and leg on the center of his or her body as shown in the illustration. This will make a base support smaller. Put the user toward and rather than push him or her. Pulling causes less friction. Move your center of gravity horizontally as possible. It is easier to move things if you use your whole body. Do not twist your body. Set your toes to direction toward which you are pushing the item. So do not twist your body. Set your toes to the direction toward which you are. Kung nasaan nakaharap yung toes mo, dun ka magli-lift. Okay? Not different direction. A bigger burden will be on your lower back if you twist your body. Use principle of leverage. Create a fulcrum and you can turn a small amount of force into a big one. Fulcrum points to prevent the lower back pain. So use the abilities of the user. Confirm the state of user and his or her abilities. Use assistive device as lift, sliding board, etc. Use body mechanics. Review your lifestyle. It is important to engage in moderate amount of exercise, have a proper nutrition and rest. So there are two different kind of equipment that you can use, the lift and the sliding board. Mental health and etc. No? Mental health management. It is necessary to maintain the mental health of care worker for them to keep engaging in core work. Many have worries and anxieties but do not take it all on yourself. It is necessary for the health and mind and body to live in regular life. Pause muna natin. Mental health management. It is necessary to maintain the mental health of care workers for them to keep engaging in care work. You may have worries and anxieties but do not take it all on yourself. It is necessary for the health of mind and body to live a regular life. How to maintain mental health? Number 1, ensure time for meals and sleep. Okay, so may oras para sa pagkain at sa pagtulog or pag-rest. Okay. Find a way to get rid of stress. that is suitable to you. For example, um, uh, magkaroon kayo ng time to have fun, like singing in karaoke. Next is have a consultation with your seniors and colleague. Yan. Importante may kausap ka. Number 4, infectious disease and control measures. Basic knowledge of infectious disease. An infectious disease is an illness in which a pathogen, etc., enters the body and causes various symptoms. Users have a low resistance to disease. Moreover, when the people are living in a group, they have the high chance of getting infected. Therefore, it is necessary for each care worker to have knowledge of infectious disease. Person with low resistance to disease is more vulnerable to infectious disease, like the aged people. A healthy person is less vulnerable to infectious disease, so he can fight against infection. There are kinds of pathogens. Pathogens include viruses, bacteria, fungi, parasites, and others. Perspective of observation. It is important to observe user as a control measure of infectious disease. As per perspective of observation, if you find symptoms such as fever, vomiting, diarrhea, stomach or rashes, or pale complexion, it is important to report it to the medical staff. There are 3 factors of infectious disease. Principles of control measures. There are 3 factors of infectious disease. There are source of infection, route of infection, and host. These are the key points. 1 is source of infection, 2 is route of infection, and 3 is the host. That are the 3 factors of infectious disease. An infectious disease spreads when the 3 factors are connected. The principle of infection control is to cut the chain off. The chain can be cut off by removing the source of infection, blocking the route of infection, and number 3, improving the host or the person's resistance to disease. So that the chain can be cut off by number 1, removing the source of infection, number 2, blocking the route of infection, and number 3, improving the host or the person's resistance to disease. So that are the 3 factors. So for example, 3 factors of infectious disease. Principles of cutting off them. For example, the host. We have the people, the animals, etc. We can cut them off. And also the route of infection, for example, the hands, the supplies, and foods. The source of infection, example, pathogenic microorganism, vomitus, urine, feces, etc. There are 3 basic rules for controlling infection. Number 1, do not bring infection in. 2, do not take infection out. And number 3, do not spread infection. Kinds of route of infection. We have number 1, droplet. Number 2, airborne infection. And number 3, contagious infection. So for the droplet infection, for example, we have influenza, etc. The airborne infection are, for example, tuberculosis, measles, etc. And we have contagious infections such as norovirus, E. coli, and etc. Okay. So by droplet, for example, by coughing, airborne infection through the air, and contagious infection is through direct touch. Kinds of source of infection: we have the blood, we have the fluid, saliva, nasal mucus, and we have a vomitus, urine, feces, etc. That are the source of infection. So, standard precaution. The basic idea is that blood and body fluid secretion, vomitus, urine, feces, wounds, skin, mucous, membranes, etc. of every patient must be treated as something that has a risk infection. Never touch blood, fluid, body fluids, vomitus, urine, feces, etc. with the bare hands. Be sure to wear gloves and providing nursing care. Example of supplies used are gloves, vinyl apron, and mask. You need to wash your hands even if you wear a pair of gloves. There's correct way of wearing a mask. For example, cover your face all from nose to your chin. Okay, so how to change disposable gloves? Throw them away with the dirty inside. Throw them away with a dirty side inside. Dirty side inside. Number 2, throw them away in the designated place. Number 3, change them after each action. So, to wash hands and points to remember, you should wash your hands either with running water and liquid soap or with an alcohol-based antiseptic hand rub. Parts that are easy to get dirty. So parts that are most vulnerable to insufficient hand washing, and parts that are often vulnerable for insufficient hand washing. So the parts easy to get dirty are fingertips, the area between fingers and back of the hand, the base of the thumb, and the wrist. So washing hands with running water and liquid soap. Number 1, remove the rings and watches. Number 2, wet your fingers and with the running water and hands with the running water. Pour appropriate amount of liquid soap in your palm and then rub your palm against each other, creating a thick lather, and wash thoroughly. Number 5, rub and wash the back of your hand with your palm of your other hand, both hands. And number 6, interlace your fingers to rub and wash the area between the fingers of both hands. Number 7, wrap the thumb of the hands with the other hand, rub and wash it both hands. Then number 8, rub and wash the fingertips of the hand against the palm of the other hand, both hands. And then number 9 is carefully rub and wash all the way to both wrists. Number 10, rinse well with the running water, and 11, wipe off moisture with paper towel and dry your hands thoroughly. We also have the alcohol-based antiseptic hand rub. So number 1, if your hands are visibly soiled, first wash them with liquid soap following the recommended procedure prescribed on the previous page. So number 2, bend your fingers slightly and take an appropriate amount of sprayed antiseptic hand rub on your hands. Number 3, rub the palm of the hands against that of the other hand. Number 4, the fingertips and the back of the hand with the other hand. And then rub the back of the one hand with palm on the with palm of the other hand, both hands. Number 6, interlace your finger to rub the area between the fingers of both hands. And number 7, rub the thumb of one hand with other hand and the wrist and rub it both hands. And number 8, carefully rub all the way both wrists and rub until dry. Accident prevention and safety measures. So users are vulnerable to accidents due to old age and disability. Prevention of falling and falling off. Walking, lifting, transferring activities are frequent in the life space of the user, which makes accidents easy to happen. Carefully observe the state of the user. There are times when the user cannot do what she or he usually can. Number 2, confirm whether the user clothes and footwear are appropriate. Slippery can easily come off and they can easily make the wearer slip. If the legs of the pants are too long, they tend to make the wearer trip on the bottom edge. Inspect the assistive device before use. So, out of order equipment can cause accident. Confirm the environment. It is easy to slip on a wet floor. It is easy to fall if you trip a cord. Risk management. Risk management refers to predicting possible risk, getting involved as an organization, and working to prevent accident. The way of thinking about predicting risk and preventing whatever is preventable is important. Keeping records properly helps identify risks. It is essential to keep records to prevent accident. Specific example of risk management. Number 1, while transferring from the bed to a wheelchair, the user is nearly fell. Number 2, this is a sample of a specific example of risk management. Number 2, so think why it happened. The brake was not active. Record the incident. Number 3, preventive measure. Make sure to confirm that the brake is activated. The next time onward, share the information to everyone. Okay. Next, we have a disaster preparedness measure. Disaster refers to the damage caused by earthquake, typhoon, fire, etc. Facilities and communities regularly have cooperation system for disasters and emergencies. It is important to be prepared for disaster to avoid panicking, even in the case of a sudden disaster. Prepare necessary supplies. For example, face mask, gloves, helmet, tissue, towel, money, lighters, kit, medical kit, flashlight, first aid kit, radio, tissue, canned goods, and jackets or clothes. Implement emergency drill.